Your original hometown dealer, Saida, Trudeau Chrysler Jeep Dodge and Ram.
Our COVID trajectory within Nye County has remained relatively stable since my last report. Most new cases continue to occur in Pahrump, and there have been no additional deaths. Currently, Pahrump cases stand at 487 total cases. Amargosa at 17, Beatty 13, Tonopah 22, Smoky Valley 4, Manhattan 1, and Gabbs 1. I would like to tell you that I believe the Manhattan is going to be inaccurate. It is listed on the state. However, we have been unable to identify that street in Manhattan, and we've also been unable to identify that individual. The person listed on the state report has not returned any of our phone calls, and we have no such address to go out and do a physical follow-up. We believe it may actually be a Clark County case. So that leaves us with 545 cases, which is an increase of 39 since the last BOCC meeting. We've also increased the number of antibody tests to 10, and 8 previously transferred to Clark County for a total of 527, which includes the 15 deaths. Our recovery status is approximately 450. I talked to the state just before this meeting, and we're looking at changing that number and improving the outcome, showing a substantially higher number. Our hospitalization remains stable in both Las Vegas and in Pahrump. Several of our residents do remain in hospitals, however, and 2 are listed in critical condition. Several new cases had underlying medical conditions, including diabetes, cardiac and respiratory histories, and most new cases were transmitted between the family members and not established to a particular type of business or entity other than a federal detention center located in Pahrump. Testing continues with interest, and testing still on the decline. We are completing vaccination training in northern, central, and south and southern Nye County. Specifically, Tonopah has completed their vaccination training last Friday. We're waiting for the dates for Beatty, and Pahrumps are scheduled for 2 sessions on October 14th. Our response objectives remain valid and continue accordingly. Well, flu pods, as a side note, are established. We are working on the final schedule. We are trying to get Amargosa into that schedule on a trip up to Beatty, and we're working with the county health nurse on that. Our recovery objectives are to manage all available funding for Nye County and make sure the recovery process is appropriate, ensure to continue collaboration between all county entities for safe operations, and also to ensure the coordination and reporting of all of our stats and appropriate actions in support of our reopening program or plan. As you know, Commissioner Koenig, we have that meeting again this coming Thursday. Rapid response to COVID has been good within the outbreaks, and we are continuing to hold steady with our PPE, including our testing kits, and our emergency service burn rate is in alignment with our access to the equipment and supplies.